In Canada, for patients who have multiple myeloma and who have received at least 2 prior lines of therapy, which include lenalidomide and bortezomib, they are typically given pomalidomide as standard treatment. We do recognize that pomalidomide is an effective drug, but unfortunately, the remission rates and the durability of the remission are not as good as we would hope that it could be. So with this in mind, we are hopeful that we can improve upon this with the addition of some of the newer drugs. The MMY1001 study is a study where daratumumab is being added to various other drugs in an effort to see what the best combination is with daratumumab in patients who have received greater than 2 prior lines of therapy and prior exposure to an IMiD and a proteasome inhibitor. At ASH 2017, this was updated and presented particularly in patients who had daratumumab in combination with pomalidomide. What was impressive about this study is that 2/3 of patients had a response to this combination. And when they looked at the patients who did have a response, their response was quite prolonged and they did well for many months. Tolerability was also excellent in this group of patients. And so with this combination, it is essentially showing us that you can combine daratumumab with pomalidomide, and that this combination, when effective, can lead to prolonged durations of remission. Once again, with this trial, similarly to other trials, there are infusion-related reactions which occur within the first cycle of treatment. Beyond that, patients tend to do much better. And in fact, the burden upon the patient and the hospital is reasonable given that daratumumab, after the first 6 months, is only given once monthly. Overall, I think this study is extremely helpful to Canadian physicians. This will be practice-changing once we do have availability of daratumumab. I think that this study reassures us there are other studies that are looking at pomalidomide in combination with daratumumab, and they show similar degrees of efficacy as well as tolerability. Once again, in most academic centers, there is a certain degree of comfort with using a combination of an IMiD plus daratumumab, and I think this further reinforces to us how relatively easy it is to give this combination and what to expect in terms of the response and durability of response.